Vical helps clinical trial patients seamlessly integrate their trial obligations into their daily lives. The journey at Vical begins when a clinician recruits candidates for the trial. Here we have James Wilson, a clinician at the Stony Brook Medical Center, about to create an entry for Amy Fowler, who was recently selected for a clinical trial. Once James enters Amy's information into Vical's admin portal, an email is sent to her with a unique username and password. Amy can install the Android app and use this username and password to access its features. While Amy logs in, let us see what James Wilson is up to. Wilson is creating an appointment for Amy to attend the trial orientation today. With only a few short clicks, he can schedule a time for Amy to come attend the orientation session. He can ensure that there is no confusion on the date and time of the event because Amy will view this appointment from within her mobile app. Let's go back to Amy. The Vical mobile app has 5 main features: appointments, messages, personal diary, trial center, and clinical trial information. In the appointment section, Amy can view any appointments that James Wilson or other clinicians have made for her. Amy is anxious to know how this particular appointment affects her daily schedule. She can head into Android's calendar application and view a seamless view of her personal appointments and the clinical trial obligation. This allows her to figure out how much time she needs to set aside to actually attend the orientation session. Amy is feeling anxious today. She was feeling nauseous earlier and wants to know if it has anything to do with the clinical trials. With messages, Amy can send private messages and reach out to her clinicians for advice. With messages, we are opening a channel of communication between Amy and the clinicians so she can be provided with clarifications for her doubts and, more importantly, an empathetic ear. These messages are monitored by clinicians such as James Wilson so they can promptly address Amy's questions or concerns. Wilson or another clinician may reply to Amy's question. Amy receives answers in a timely manner, which helps reduce some of her anxiety. She gets an alert on her phone every time she receives a reply. Amy can reply from within the app itself. The personal diary. Amy is thinking, geez, I should keep track of when I feel nauseous. There might be a pattern here. Amy can take detailed notes for herself about anything that's going on in her personal life that affects the clinical trial or is affected by it. The diary is visible only to Amy. She can log relevant information here. Vical provides Amy with a one-stop shop view of all the contact information and directions to the trial center. Also, clinicaltrial.gov has valuable information regarding the trial. Amy can view this information on the go from within Vical. With Vical, we are trying to make Amy a happier clinical trial participant, a more engaged and educated patient, and someone who would stick around and complete the trial. By ensuring seamless interaction between Amy and her clinicians, Vical makes it easy for her to manage her trials. If you have any questions or concerns, please contact us.